Welcome to the SCI Forum podcast. This podcast was produced by the Northwest Regional Spinal Cord Injury System in the University of Washington Department of Rehabilitation Medicine. The Northwest Regional SCI system is dedicated to improving the lives of people with SCI through excellent patient care, research, and education. To learn more about our podcasts and videos or to make a donation, go to sci.washington.edu.
Hello and welcome to the Spinal Cord Injury Forum podcast. My name is Jeannie Hoffman and I'm a clinical psychologist and professor at the University of Washington in the Department of Rehabilitation Medicine. We are adding to our previous series on those folks, therapists, and others who work with people who have had a spinal cord injury. And today we're meeting Amy Starosta, who's a rehabilitation psychologist, similar to me. So Amy is a clinical psychologist and assistant professor in the University of Washington Department of Rehabilitation Medicine. And she's an attending psychologist on inpatient rehabilitation at Harborview Medical Center. So Amy, thank you so much for joining me today.
Thanks for having me. It's a pleasure to be here.
So I think always the first question is kind of what is a rehabilitation psychologist? How do you become a rehabilitation psychologist?
Good question. I think that rehabilitation psychology is something that many people have never heard of before, never met with before. And I'm going to be honest, when I was in grad school, I hadn't even heard of it either. So rehabilitation psychology is really focused on working with individuals who are experiencing acute, chronic, new, ongoing medical issues and helping them to both develop the coping skills, the adjustment, the transitions needed to get through either early or later processes, but also to focus in on many of the medical conditions that we know have a really strong psychological and behavioral component. Things like pain, sleep, activity, exercise, medication management. All of these pieces are things that your physician is talking to you about and helping you with, but that you have to make some sort of behavioral change to accommodate. So you can think about your rehabilitation psychologist as someone that helps with the mood, the emotions, the reactions that go along with medical conditions, as well as the behavior changes that need to happen for you to be able to successfully live a life that's valuable and important to you, even with your medical conditions.
That's a great description, Amy. I wish, well, now we do have it recorded, so I can play that for other people. I think it is a specialty area of psychology, so not one that everybody goes into, but requires more broad experience in health, which is great and different than even health psychologists who tend to kind of focus on one condition or another, but kind of a specialty area of health psychology also, I think of. You said when you were in graduate school, similar to me, didn't know even rehab psychology existed. So how did you end up in rehab psychology? What was your pathway?
I went to graduate school for clinical psychology at the University of Albany, State University of New York. There I studied clinical psychology more as you would think about it. But a lot of the research that I did focused on health behaviors, how people choose to eat, how people overeat or undereat. I also did a lot of work about how people make decisions about reproductive behavior, risky behavior, alcohol use, condom use, those sorts of things. And over time, I did more and more work in this health behavior field, the sorts of behaviors that impact your long-term health with these immediate short-term kinds of decisions. And clinically, I was working in medical settings. And so I think that was my first real introduction to what it looks like to be a clinical psychologist, not just a research psychologist working in really health psychology. So as you mentioned, Jeannie, I think there's a tremendous amount of overlap between health psychology and rehabilitation psychology. I continued my training, mostly working with individuals in different medical settings, medical contexts, always being the psychology representative for individuals in those places. And that included, skilled nursing facilities, that included hospice settings, that included oncology settings, integrated primary care. And I learned about rehabilitation psychology really through the University of Washington, that in the process of going through all of the different applications for training as a clinical psychologist, you go to graduate school and then you go somewhere else to do a year of residency training. And then a lot of times you go somewhere else to do a fellowship training. I had applied to work at the University of Washington for some of my training experiences and learned about all the work that the faculty was doing here. And that was something that always stayed in the back of my mind as I went through other settings, that the kind of work that I saw Dr. Hoffman doing, Dr. Bombardier doing, a lot of the other investigators who are involved in care here, that was something that I was really interested in. So I kept applying here and eventually came here about 6 years ago as a faculty member to start working at Harborview Medical Center.
And we're thrilled that you made it to us. Absolutely. So tell me a little bit about kind of what it piqued your interest, because I know that you do research in spinal cord injury as well, but what about spinal cord injury has intrigued you, has made it a focus for you?
Spinal cord injury as a experience to go through is such a unique experience for the individual, and one in which you so rarely have a point of reference for. So when someone comes into the hospital after having a spinal cord injury, it's really unusual that they know anyone else who has gone through that experience. They unlikely have ever gone through that experience before, and probably haven't gone through something even similar in the rehab realm. The degree to which things change in every aspect of your life is profound. And I think that one of the things that I find really valuable about being able to offer support and intervention to people at the early stages is that if we can provide people some tools and some skills and also a positive experience, that we can help them to continue to cope throughout that transition that occurs much beyond just the walls of the hospital. Knowing that people don't necessarily have another place for clear, consistent, accurate information, it's really important to me to help them identify where they can go to for information, like these podcasts, like the SCI forum information, but also to have a place that they can reflect on everything that they're going through as well, because I think it can be very isolating and alienating when you don't have other people who have gone through something similar.
Yeah, that's a great description. And I do see spinal cord injury as in somewhat like the kind of ideal descriptor of what a rehabilitation psychologist can do for people across kind of all those domains that you mentioned, because they do have to change health behavior. They do have often pain is a very common co-occurring. They often struggle with sleep issues for a variety of reasons. There's sometimes mood, sometimes not, but a huge amount of adjustment. So they kind of tick off all of the boxes of the things that we would evaluate and follow up on. So for your work right now, you're kind of focused on inpatient rehabilitation, but psychologists see people with spinal cord injury kind of across the continuum of care, from kind of the acute level through long-term outpatient. And so could you just talk a little bit about kind of why somebody might want to see a rehabilitation psychologist at each of those time periods? So if we just start in acute care, in kind of inpatient rehab, and then on an outpatient basis.
I think the reasons that you might want to see a psychologist at any stage in your both rehabilitation as well as ongoing management of spinal cord injury could vary based on the stage that you're in or the experiences that you're having. Inpatient rehabilitation is like drinking from a fire hose. And so the amount of information that you're getting, the amount of change that you're experiencing, there are going to be many things that you're not ready to think through, to deal with, or haven't even been exposed to yet because you're still in the hospital. And so I think that when you're on the inpatient rehabilitation side, a lot of the intervention from psychology is very much that just initial grounding, initial validating, initial coping, and then also starting to understand more about what's important to you and addressing those immediate needs. A lot of times it's things like pain, things like anxiety, being overwhelmed, how to engage best with your therapies, and then how to transition to the next stages. And that transition point, I think, is really important to consider because transitions happen throughout our life. Transitions can happen as we age, as we become a parent, as relationships begin or relationships end. And they can also happen in reaction to changes in your medical condition. And so I think transition is a really good point to consider. Would it be helpful to reach out for additional resources? Do I feel like I have everything that I need here? Or do I need to make some space for either my reaction to what's going on or change some of my behaviors in order to keep myself moving in a direction that's important to me? And then I think sometimes those transitions are much more abrupt. Things like having a sudden change in your medical condition, or having increases in pain, or noticing that your sleep is terrible. Those are all conditions that a rehabilitation psychologist can be helpful for. And I think this is important to notice that just because you go to see a psychologist doesn't mean that you're going to see a psychologist forever. You could have a short course of meeting with someone 6 to 12 times that addresses a specific thing that's going on, and then you can move on. You may do that a couple of different times throughout your life, and that would be completely appropriate use of the resource.
I'm going to say I've had the, I guess, privilege to be able to see some people at many time points post injury. So people I had met when I worked on inpatient rehab and then came to see me on an outpatient basis for a course of treatment. And then later on, again, revisited for a different course of treatment, again, with different issues, as you mentioned. So kind of that early adjustment, education, support, but then the next of really trying to manage with somebody with tetraplegia, the home-based business. Like, how do you become a boss when you're not used to becoming a boss? And later that pain became an issue, for example, or other kinds of conditions can come up. So I agree that it kind of, it depends on what people need. But I think inpatient rehab, at least at a specialty inpatient rehab center, everyone sees rehabilitation psychology, whereas on an outpatient basis, it really is dependent on what your needs are, as you mentioned, like what the question is. And even on the acute side, it would only be some small proportion of people see somebody before they come to inpatient rehabilitation if they're struggling with that early coping. One of the questions that I've talked to a lot of the therapists about is that there's differences in how they approach people who have paraplegia versus tetraplegia. Do you feel like there's much difference in how you approach or the things that you feel like you need to assess or think about with people?
On a whole, I would say that my approach is very individual specific. And so the things that affect how I approach somebody is less about the specifics of their injury and more about the specifics of them, of what seems to be important to them, what seems to be approach that makes them feel comfortable, how I can best build a relationship with that individual. I will say that there are probably some things that I might think more about for individuals who have a higher level injuries and are weaning from a ventilator. I think the ventilator piece adds this additional component of management and medical care that has its own needs, and communication styles might be different based on that. What the patient is able to do to cope is going to be different too when you don't have control of your own breathing. Other than that, as a specific thing, I think often it's more individual led about what kinds of topic areas that we're going to be focusing on.
Yeah, I definitely have noticed that too, that disability or the ability to cope with injury is not necessarily related to the level of injury or what people might call severity of injury. So yeah, interesting to think about how that difference happens between different kinds of professions. So one of the other questions I've asked other people is that kind of overlap, like how much overlap happens between rehabilitation psychology and occupational therapy, physical therapy, physicians, nurses, kind of, and across kind of the inpatient outpatient realm.
I can speak mostly to the inpatient realm because that's where I've been the most significantly integrated for a while. And this is one of the things that I value about my job the most is that I'm incredibly integrated with the team here, and that the work that I'm doing with an individual doesn't happen in isolation. And for me, that's really important because me spending 30 minutes with you is not as valuable as the rest of your 23 hours and 30 minutes. And so I work with a team that I can share the things that I'm doing with somebody and the things that have been helpful for them, the things that they say are important to them with that team. And that team is also going to reflect those same things back. Now, they may not be doing cognitive behavioral therapy with somebody. However, they are all reinforcing all the things that we're trying to work on. And so I find that that approach is so much more effective than me operating in isolation. But that makes sense based on the context. Like I said, it's such a overwhelming amount of information that it's really helpful to have all the teams on the same page. On the flip side of that, I'm getting information from the team about what's going well and what areas they're seeing. And sometimes patients are not always aware of the things that might help them. And the therapists and the nurses can help me with that too. And I think that helps me to be more effective because I'm able to get information from multiple sources and know more about what full holistic healthcare looks like and help individuals to access that. I think on the outpatient side, that same thing can happen as well. And that's the nice thing about seeing a real rehabilitation psychologist who is integrated in with a team is that they can understand more about what you're doing with your other therapists. And that can, I think, only help to amplify the work that you're doing with them. And it goes both ways. Similarly, they can give recommendations to your team about how your work with your team might be able to be more effective. And they're learning from your team about things that you might want to work on that you may not be aware of because you're not a physical therapist.
Yeah, I think that's great. And I think we do a lot of work, especially on the outpatient basis with other people's physicians, and especially their rehab physicians. But things that require more complex interventions like pain, where somebody might need medications as well as non-pharmacological interventions, or sleep, again, same thing, of sometimes a combination of meds, but also, again, that we have a lot of behavioral strategies to help with that as well. So yeah, I love that. And that's why I love rehab and have always enjoyed working with spinal cord injury, especially. What do you love about it? What makes you excited about being at work every day? What makes it fun to be at work?
The team-based approach is really something that I care deeply about, both from the perspective of the patients, but also from the perspective of the team. That working in healthcare is really challenging, and working at Harborview has its own reputation and experience. And so I see a really big part of my job as helping other providers to be good at what they're doing. And so whether that be specific interventions where we're giving people feedback on how to do better motivational interviewing so that they can be more effective in their session, talking to teams about how to do more trauma-informed care so that they're being more collaborative with patients, that they're being more comforting and safe, encouraging safety for patients, but also just being there with my team to help them be more effective and more self-care for themselves. Those sorts of things I think are really important to me, but I ultimately think that makes it so that the patients are getting better care. And having a team that supports each other and functions well together is, I think, the best way that we can put patients first.
I love that, because this is exactly why we're so excited to have you with us, because that is the type of commitment and the type of work that we love. I just also want to add, I think that I've done this for many, many, many years now. And I think that I'm always struck by how resilient people really are. And so to be able to be part of supporting that resilience and helping boost that has been a huge part of it, and such a great part of working with people with spinal cord injury, because I've gotten to see the whole span of that early just adjustment and getting your head around this new experience and this different life to people being successful and happy with families and work and other kind of important things out in their world many, many years post-injury, and met many people who are, gosh, injured long before I ever got into the field and are still doing great stuff.
I think to your point earlier about at what point would you need to or want to go see a rehabilitation psychologist, I just want to highlight too that needing to go see someone or going back to see someone again is in no way, shape, or form like a failing or a lack of skills or a lack of ability. And if anything, I think as psychologists, we love to see people come back for something different. And that is almost a representation of how much you're growing, that there's something new that you want to advance on, something new that you want to improve in. And so we're happy to continue to support you throughout your lifespan.
So yeah, I totally agree. I think that sometimes people have views of seeing a psychologist as being that there's something wrong, but in fact, it can actually be to help things be more right, to feel like you're doing better and tackling things. And I think rehabilitation psychology is definitely one of those where as health changes, and I've actually seen quite a number of people on the outpatient basis that are doing kind of adjustment to aging with spinal cord injury. And that's a whole kind of different thing. And it's not that there's anything wrong necessarily, but it's a whole different way of thinking, and a different way sometimes needing to change coping strategies. So definitely agree with that. Are there other things that you feel like are important for people to know about rehabilitation psychology or about you?
I think that one of the important things to highlight is part of the reason why rehabilitation psychology and health psychology is such an important part of your medical team is that we're learning more and more that health is not just the physical components of what you're experiencing. There are many different factors that contribute to your health, and ignoring half of those factors means that your health is not going to be as optimal as it could be. And so now we try to take this approach of the biopsychosocial model. And the biology, as you can hear from the word, is just one part of that, that there's many social components and psychological components that are going to change what your health is. That you can think about these things in small scale with how you manage stress. Your blood pressure goes up. We could just treat you with a blood pressure medication, but that's not actually addressing what's going on. Similarly, even with spinal cord injury, the biopsychosocial model is a really important part of how you think holistically about managing your health for ongoing basis. And so I think that's a big component of why you want to have experience with a rehabilitation psychologist at different stages of your recovery and of management of your injury.
That's great. I actually want you to do a little bit more on the biopsychosocial model.
The biopsychosocial model takes into account that there are many different factors that influence your health. The biology part of it is what we traditionally think about in healthcare. So that is your level of injury, your blood pressure, the labs that we get when we draw blood from you. And those are maybe the medications that you're getting to manage different parts of your health. But we also have these other components that we, over the past couple of decades, have learned are really important. And so the psychology piece is thinking about your cognition, how you think about things, how you react to things, emotional components of how you're managing stress, how you're coping, how you're adjusting, the coping strategies that you use as well. And then we also have this social component of the environments that you're in, your jobs, your relationships, the greater society in which we live that, as we know, has a lot of limitations in how it supports or doesn't support people who are living with disability or other marginalized identities. And all of these factors are really important for considering the full picture of your health. And because of that, rehabilitation psychology is heavily embedded in the care following spinal cord injury and many other conditions because we are uniquely positioned to help you address many of those other factors beyond just the biology of your injury.
So I think that, one thing about kind of seeing a psychologist or seeing a mental health provider, I think in my career so far, that has really improved in terms of people not having so much stigma associated with it or assuming that there is something wrong with them or they're crazy or whatever. But I think there's still some of that worry for people that they feel like if they see a psychologist of any sort, that it might mean they have something wrong with them. And so when you talk to people about thinking about that outpatient provider opportunity, what kinds of things do you recommend, or how do you provide information about what it would be like to see a rehabilitation psychologist in the outpatient realm?
I appreciate that there's still a stigma around mental health care. It certainly is continuing to improve. And I think in the wake of the COVID-19 pandemic, a lot of people have a different approach or a different willingness to engage with that. I'm encouraged by that. And at the same time, I think that's not the case for everyone. I guess I would ask someone who is feeling that stigma or feeling that resistance. We don't expect you to know how to do things without learning them in any other realm of our life. We don't expect you just to be able to hop on a bike when you're a child and start pedaling it without some instruction. We don't expect you to know how to do your bowel care or how to use a power wheelchair without a lot of instruction and a lot of practice. Why do we expect people to know how to cope with life-changing, life-altering, challenging chronic medical conditions without some help and some support? And I think that that can be the most basic intervention from rehabilitation psychology, is to help you identify what it is that you're already doing that's working, amplify that, get better at it, and also maybe create some awareness about some of the things that might not be working for you. And so if you're considering seeing a rehabilitation psychologist, it's probably because you're seeing something that's not working for you, and you don't have to keep dealing with it by yourself. And so there are trained people who are available who have a lot of experience of seeing what other people have done to help, as well as what the research shows helps. And they're going to be very tailored to you as an individual. They're not there to point out what you're doing wrong, to make a diagnosis. They're there to help you make the most out of your life and your values. And so I think there's not much to lose in terms of engaging with those people who their expertise is all about helping you to thrive.
So we know that there's fantastic rehabilitation psychologists in our system, but we are a small number in relationship to the number of people that potentially would benefit from us. So what advice do you give for people who may not be able to access, because of where they live or because of availability, like a rehabilitation psychologist? How do you decide like when to see a specialty care provider versus another psychologist in the community? And kind of what advice do you give to people in finding somebody?
I think especially if you're in an environment where you're needing to work with someone who maybe doesn't have as much expertise with spinal cord injury, for any psychology provider, it's important to have a good fit with that person. It's okay if you meet with someone and you just don't feel like that's the right person for you. I know that's hard in the current context that there's just not a lot of accessibility. But if you're really feeling like somebody else is going to be a better fit, I highly recommend that you do a little shopping around, meet with a couple of people to determine if someone's going to be a good fit for you. And I think a good fit for you is going to be somebody who is able to integrate your experience and the totality of your experience as well. So you're going to be looking for somebody who has a good background in evidence-based therapies like cognitive behavioral therapy, like acceptance and commitment therapy, and others as well, who is able to flexibly integrate that based off of your experience as someone living with spinal cord injury. And I think you can be upfront with talking to people about what is their understanding of, and do you got a good vibe of if they're going to be able to hear you and then integrate, because I think that's really a very reasonable thing for a skilled psychologist to be able to do, and a very reasonable thing for many of these evidence-based interventions that we know can be helpful, to be flexible and meet your needs regardless of whether it's at the University of Washington or not.
Perfect.
Your psychologist or your rehabilitation psychologist obviously has a clinical training and background and informational understanding of many of the things that you're going through. They may not have a personal connection to your lived experience. In an ideal world, it would be great to have people who can empathize and sympathize with what you're going through. And that's not always necessarily the most important piece. I'm reminded of a metaphor that I often use with patients. You are on your own path. You're making your own journey, and I am not on the same path. I'm on a different one. Because of my perspective, I might be able to see things, barriers, obstacles in your path that you can't see because of your perspective. And so my role is not to tell you exactly how to get from point A to point B on your path because of me already having traveled it. Rather, it's for me to say, hey, I'm noticing that there's a giant boulder in the middle of your path. If we shift over, you might be able to get around it more efficiently or better. And so I think that sort of collaborative approach is what's really important, that I'm not the expert on your path or your journey from having moved through it. Rather, I'm able to offer you some different advice or different recommendations based on the perspective that I have, as well as my own experience.
And I think that's actually a really great way to decide that fit that you talk about. Because if somebody sees a therapist who is telling them what their experience is, that's probably not a good fit. But if they're listening and they're open and they're asking questions, that probably is going to be a better fit for you, because they're actually trying to figure out what those obstacles are for you, as opposed to trying to definitely assume that they know something about you or your experience that they don't know. Amy, thank you so much for joining us today. I think this is going to be a great contribution to our list of SCI providers, and I'm thrilled to have you with us at UW Medicine, as well as being on the podcast with me today. So thank you.
Thank you. It's been a pleasure to chat with you today.
Thank you for listening to the SCI Forum podcast. To learn more or to make a donation, please visit sci.washington.edu.